Dr. Nagasaka, there was a question about ROS1. Are there any pitfalls with ROS1 adenosquamous lung cancer? So we know that these are generally adeno, but you can see it in squamous histology and adenosquamous. Can TKIs, can Pemetrexed still be effective for this squamous part of the tumor? And is bevacizumab safe in the case of a mixed histology? So a couple of very good questions. Why don't I let you take a stab?
So those are excellent questions. I also think that there might not be a straightforward answer to this one. It is true when you have a squamous histology, the efficacy of pemetrexed isn't that well, and sometimes I like to use a more general chemo like taxanes. But in this particular scenario, ROS1 was also detected too, right? So in a scenario like that, I would probably start with a ROS1 inhibitor and see how much response you get. And then, if at all possible, would try to biopsy the residual disease or resistant disease and see what's going on. And you might see that the only area left is actually squamous now.
Yeah, I agree. I think that TKIs can work even in a pure squamous histology. We can see responses. There's some thought that maybe the outcomes are not quite as robust, but small numbers to really be sure. So I think the TKI certainly is appropriate. Pemetrexed is only approved for non-squamous, and it's not a question of safety, it's a question of efficacy. Squamous tumors have a high expression of something called thymidylate synthase, which predicts response to or resistance to Pemetrexed. And so, as Dr. Nagasaka said, we usually favor other chemotherapy agents like taxanes. Bevacizumab is a tricky one, and while it sort of depends on the details and how much squamous histology is there, the concern of bevacizumab in a squamous histology is an increased risk of hemoptysis, which is bleeding with coughing and in some cases can be fatal. And that's probably a bit risky. So bevacizumab, something we probably avoid if there's a lot of squamous component, but the TKI certainly I would move forward with.